Hello, YouTube people. I'm Dr. Chris Daly, and welcome to Daily Dose, working title. So today I'm going to talk about weight gain with antidepressants. And to start off that topic, I am going to say that I picked that topic because I was thinking, what is the thing that people would be most interested in learning about for antidepressants? What's the most common thing? Now, I thought it would be something like, how long do I need to take an antidepressant, or which antidepressant is the most effective, or are antidepressants right for me? So I did a little Google search. I put which antidepressant, and the number one thing that came up was which antidepressant is best for weight loss. And then I think the third item on there, which was which antidepressant causes weight gain. So I'm just going to talk a little bit about that and break it down for you. Just as a reminder, although I am a physician and a psychiatrist, I am not your physician and your psychiatrist, and this is not meant as medical advice, and I'm not treating you. So you have to go find your own doctor. And this isn't like a whole treatment thing we're doing. This is just me putting out information there. And this is actually a really frequently asked question. And I'm going to deconstruct this question in a little bit, but just that's the disclaimer that I wanted to make clear. Okay, so why do I think this is the number one question that people are asking? And maybe if this is the first question on the top of your head, you don't need that answered. But I did some reflecting on this because on the doctor side of things, you really are in this frame of mind that you're there to help and diagnose a problem, and that the problem that you're treating is pretty serious and causing a lot of pain and suffering, as depression does. I mean, depression is in our top 5 of like global medical conditions that cause people harm. So it's very common. About 20% of people will have a major depressive episode in their lifetime. And I think the point prevalence is that's like at any given point in time, about 10% of the people out there in the world are clinically depressed. And a smaller subset of those are actually getting treatment. So depression is a pretty big problem. If you're depressed, you are typically struggling with work, struggling with your personal relationships. And when it gets more and more severe, you're struggling with things like cleaning yourself, getting out of bed, eating, sleeping, all of the basics. So it's a pretty serious thing and can lead to suicidal thoughts. And suicidal thoughts and actions are one of our leading causes of death in the United States. So pretty big deal. So when you think of something like weight loss and weight gain, I'm just saying that on the doctor side of things, you're thinking like, okay, you're going through all that pain and suffering. Like, how are gaining a few pounds or losing a few pounds going to be the first thing that we're going to talk about? But the truth is that's coming up on Google. And I would say that it has come up a lot in my personal practice too. That is a big deal breaker for people, or something that's on their mind. But let me get into that even a little bit more, because I think hidden in that is kind of some bigger issues we should talk about too. Let me just say that I will talk about the specific antidepressants, and there are only a few really that can cause clinically significant weight gain. And there's only one that can really cause clinically significant weight loss. So when I'm approaching this, there's probably like 25 antidepressants out there, and most of them are weight neutral. They don't affect your weight one way or the other. So I'm thinking like, why is this such like a disconnect if most of the medications that we prescribe, particularly in this current day and age, don't have much of an impact? What's going on here? So I came up with some ideas. One thing I think that happens is that the older school antidepressants. These are the ones from the 1980s. They're all in this class called tricyclic medications. They're all things that sound like something triptyline, like nortriptyline, amitriptyline, desipramine, imipramine. You get the picture. Something amine. And these medications were from the 80s. They were very complicated to take because they affect multiple different things. They affect the neurotransmitters that help with depression. That's serotonin, norepinephrine, and dopamine. But they do other stuff too. They all have like kind of some antihistamine properties, which can cause weight gain. They also can cause you to feel sleepy and mellow, which can be a desired side effect. They also are what's called antimuscarinic, which means they have like anticholinergic side effects, which can be constipation, dry mouth, dry eyes, and for elderly people can cause confusion. They also have this other side effect that makes it, you're more predisposed to, your blood pressure can drop if you stand up too quickly. It's called orthostatic hypotension. Finally, these medications are fatal in overdose. They can mess up your heart rhythm. So these were our first antidepressants that we had. They're all very effective. However, based on all these side effects, they were pretty clunky to prescribe. Okay, I'm back. Okay, side note on this. These medications are still prescribed a lot, usually by primary care providers or pain clinic doctors. And I mention that because they have this other, they can help for migraines, for like pain caused by stuff going on with your nerves, usually back pain kind of stuff. And a lot of the people that are prescribing them don't know all of those side effects that I just mentioned. Just FYI. I don't know what else to say about that, but just that I've seen these medications prescribed a lot by people who don't know really all of those side effects, and the fact that there's that toxicity, and you can actually get a blood level checked. And your doctor probably doesn't know that. I don't know a better way to put that, but like never saw people aware, because these medications came from the 80s and early 90s. A lot of doctors just don't know that you can check a blood level, and you should, because there can be a lot of drug-drug interactions. I could do a whole different video on that. I don't want to get too bogged down in the tricyclic medications, but they can cause weight gain for sure. So I think part of the reason that people associate antidepressants with weight gain may come from that first class. Also another medication that I'm going to mention, but I think that's one of the reasons why people still associate antidepressants with weight gain. The second reason, there is one medication from our newer class, which are all called selective serotonin reuptake inhibitors, or serotonin norepinephrine reuptake inhibitors. And there's all different like versions and rebrandings and fancier new versions of this newer class of medications. The newer class of medications, though, became a lot more popular because they are not fatal in overdose. They pretty much just do one or maybe two things, usually just serotonin, just norepinephrine. They don't do all that other stuff that I mentioned. And because of that, they're much easier to prescribe. They're much safer to prescribe. And they were part of our kind of antidepressant prescription explosion in the, I would say, late 90s to zeros to now. Because of their ease, and part of that was some marketing. Part of it is it's reaching the people with depression who need it, but part of it has also been the marketing and profit motive in healthcare. So that's there too. And I'm sorry, and that frustrates me, but I'm just trying to be honest about that. Okay. So of the newer medications, pretty much the only one that really statistically significantly will make you gain weight is called Paxil. And I haven't figured out how to cut and put things like in the videos, so let me see if this works. I wrote it backwards. Let's see. It did work. So you see, Paxil. The generic name for that is paroxetine. So this medication is it's prescribed a lot for the anxiety depression combo because it has some sedating properties built into it. It has a little bit of the antihistamine and the anti-cholinergic that I mentioned before. Those properties make, when you take it, it has kind of, in addition to the serotonin effect, it has like a mellowing effect. It can make people feel sleepy. People take it at night. A lot of people with depression and anxiety don't sleep well. So it helps with that. But it also, because of that, can increase your appetite. And so weight gain has been associated. And in our studies and papers, what a clinically significant weight gain is defined as, it's usually like 7% of your body fat, or they'll put it sometimes in just other ways of compared to a sugar pill. Do the people taking it over 8 to 10 weeks, and that's usually the length of an antidepressant trial, is like 8 to 12 weeks. Are the people in the placebo group, that's just like a sugar pill, compared to the people taking the medication, are the people taking the medication gaining more weight than the people taking the placebo? So Paxil is one of those. I can put the paper I referenced, and I have to do another disclaimer. I don't represent any kind of third party. I can give you the citation if you want it, but I can't legally take responsibility for their studies. But this is a pretty good paper. It's what's called a meta-analysis. And a meta-analysis like exports data from other papers. It takes like thousands and thousands of pieces of data to summarize. And for something like this, when you're looking for a smaller side effect, and most studies have just like a few hundred people, if you pool the data, you can get a more sense in many situations of you can detect smaller differences. So the meta-analysis that I looked at again for this, and then I've also looked at individual papers, and then I just have also my clinical practice. The medications that came out as clinically significant weight gain, the tricyclics, interestingly though, a newer meta-analysis did not find that for nortriptyline and amitriptyline, but let's not get too detailed. But Paxil is on there. Another medication called mirtazapine, which is its own kind of antidepressant. It's in a class of its own. It's also known as Remeron. It also causes you to sleep. It has antihistamine activity built in. It's got another mechanism built in as well, but that one definitely makes you gain weight. So all of the other ones that came out as weight neutral, meaning that when they pooled all of the data, there was no statistical significant difference between that medication and a sugar pill. Those included Lexapro, Prozac, Celexa, Effexor, Cymbalta, Zoloft, and like the newer ones were in there too, like Vilazodone, also known as Vibrid, Trintellix. Pretty much all of those, Effexor, venlafaxine, are weight neutral. And I looked at papers that looked at just the 10 to 12 weeks, and then the meta-analysis that I also looked at looked out more like 3 to 6 months. Now, that's not to say, so, when you're looking at a paper like that, you see sort of a range, and it doesn't come out to be statistically significant. That is on sort of a population level. So there are some individuals who may still have associated weight gain on an individual level, but speaking for the population, it's not a statistical difference. So I know that might be confusing, but let me just say, like ibuprofen, aspirin, Lipitor, all of these, any pill that you take has some risk of weight gain. A sugar pill has risk of weight gain. So, and so I will take a little pause here because let me just take a medication like Lexapro. It's also known as escitalopram. That's one of our very middle of the roads antidepressants. It's a selective serotonin reuptake inhibitor. So like I said, the data on that, it didn't separate from placebo in terms of weight gain. There was no statistically significant difference for that on a population level. Now, that does mean that within that group, there are some people who gained weight and some people who lost weight compared to placebo who are taking the Lexapro. When they took like 10,000 data set for 10,000 people, it didn't show up as a reliable statistical significant difference. It's all so both those things that can be true, that you might be the unlucky person who does gain weight on Lexapro, or maybe you wanted to gain weight and you're a lucky person. Vice versa, some people lose weight on Lexapro, very small percentage. It's not statistically significant. Just like when you use a slot machine at Las Vegas, there are some people who they pull that thing and they like get $1,000, and I guess everybody else loses. So, but there are so there is like sort of a subset of people, a very small percentage who their weight gain, if there's a way we could scientifically verify it, would be affected in that way. I think I will also make another point here that for the most part in these studies, or a lot of time in the main studies that get antidepressants published, they pick a very selective pool of people. So usually people are excluded if they have something going on, like they're smoking weed, they're drinking alcohol, if they have like any eating disorder stuff in their past, they have any bipolar stuff in their past, they have any kind of medical issues. So let me just put that out there, that a lot of the data sets for our antidepressants come from a pretty defined pool of people. And that's something that we always run into, and something we can talk about in terms of antidepressant effectiveness too, in that, the data we're trying to use to pick an antidepressant or say this is going to be helpful for you, is based on data from studying people that are pretty much just depressed and don't have some of this other stuff going on. So that's something in the real world we run into a lot, that it just makes it harder to predict side effects and efficacy. And it's just something you should know about. And I think it's something, to be honest, that doctors should think about too, because I think the momentum of our medical system has been, doctor, you're seeing somebody, they're saying they're depressed, why aren't you giving them an antidepressant? And, or the person being like, do you not believe me? You're not validating my symptoms by not giving me this antidepressant. And I saw this commercial, and this commercial says this is going to help me. So are you going to help me? So I'm just saying that that's part of what we're dealing with in the system. I would say like 10 or 15 years ago, when I was just starting to be in the psychiatry system, the antidepressants were used much more sparingly than they are now. So, as they say, that is what it is. But I think it's one factor that might drive some of the disconnects, because if I did this too. I went on Reddit, and I've certainly had patients who are like, no, I'm not taking this, or this. They come to you kind of very like tense and scared about this issue of weight gain, because either they have taken antidepressants and gained weight in the past, or they've read stories about it on something like Reddit. So I just told you that Lexapro doesn't cause weight gain, you can find on Reddit tons of people who've gained weight on Lexapro. So there's that. Yeah. So to kind of like bring that point in, I think it's helpful to know, and it's definitely something you want to think about, if you're seeing a physician or a prescriber and they've given you Paxil or mirtazapine, you should know those will most likely cause you to gain weight. And sometimes that's a desired side effect that we want. This kind of leads me into my other point that I'm going to get to about how appetite changes are part of depression or anxiety conditions, and so it's sort of part of the complexity here. But I definitely, if it were me and I was prescribed Paxil, like first line, I would definitely never see that doctor again. I'm sorry. Like, if there wasn't a warning, that's a fucking problem. I'm just going to put that out there. It's a red flag. I want to say Paxil is a great medication in so many ways, but like, it's definitely one of our more weight gaining medications. It's a hard medication to get off of. It's you can't take it if you're pregnant, and it's one that really messes with your sex drive and sex function in a few different ways. So I kind of feel like it needs to be a conversation before you prescribe that for any of them, but certainly for Paxil. So there's that. Okay, so the next point I kind of want to make is that, and I'm going to hit pause. Okay, I'd hit a pause there. I guess I could just edit it out, but like, I did my first video on my phone, and then it took it like an hour to upload. I felt like I was back in the 90s again, where you're like watching like something slowly download on your computer. I didn't realize that, so I'm trying to break this up into smaller pieces and then Frankenstein them together. Okay, so yeah, I think this is going to lead me into something I want to make like the next video about, but just to kind of start getting there. I think the thing that this touches on for me and can be frustrating around this whole topic about weight gain and antidepressants is like do we have a handle on what's going on for you now? What's your relationship with food right now? And what's going on with your mood and food right now? Because increased appetite or decreased appetite, those are both potential symptoms of depression. You see where I'm going with this? So if our whole goal of treatment is for you to become less depressed or less anxious, because they treat anxiety too, that's a whole other topic, but then how do we think about that? Because part of our goals, part of something we should be talking about and tracking is what's going on with your appetite, separate from what the medication is doing. And eating and appetite are a big thing in the United States and kind of any developed country. Like, we have whole industries kind of designed to kind of sell you products to get you fat and get you thin. So I'd say in half or more of the cases where somebody's at the point where they're depressed enough to consider going on a medication, or just depressed enough or anxious enough that it's interfering with their life, usually there can be something else funky going on with body image, or the way that you're eating food, or the way that you're working out, the way that you're drinking alcohol or smoking weed. So there's a lot that the appetite can touch on. So that leads me into kind of my, this is almost like a sneak preview or something I want to talk about next time, but I'll introduce it now. Like, what do I think you should be thinking about in your first visit if I'm like a little bit low-key shocked that weight gain and weight loss come up more than antidepressant efficacy? Like, what should be coming up in that first conversation? I think what you want to have, if you and your provider have diagnosed clinical depression or like a clinically significant anxiety disorder that you're about to start taking medication for, you want to think of what is your treatment plan for that condition. And a treatment plan is like, yeah, what is our plan of attack? Like, what is our treatment for this? You know, how are we approaching the way I think about this? How are we approaching the behaviors that I have about this? How are we approaching what I'm taking into my body, be it medications, drugs, alcohol, all that stuff? And like, what are our time points for this? Like, how quickly is this supposed to work? When are we checking? When do I say it's working? When is it not working? And how often are we going to touch base about that? Those are the basic components of a treatment plan. And I mention that because it's hard in mental health stuff on both sides, because these things take a long time to improve, and they usually take a long time to even get to the point where they're getting treated. It's different than, you know, going in for asthma. That's usually kind of makes itself known quickly, and the medications work pretty quickly. So for an antidepressant, you know, our average time that they take to just start working is 4 to 6 weeks. And like, typically on a good day or a great trial, we have like 50% reduction in symptoms at 8 to 12 weeks. And that doesn't mean like a cure. That means like you're 50% better than you were before. You know, our average depression, I want to ballpark, it can take about 6 months to fully kind of get back, and often longer, to get back to where you were before and be fully functional. So I think it's, when I step back from this conversation, it's, to me, thinking about, okay, you're prescribing a medication or you're starting a medication. Where does that lie in this treatment plan? You know, if we're thinking about, okay, I'm going to prescribe this for you, and we're checking in, and we want to try to get you remitted in this 3 to 6 month time period. And 6 months would still be a very quick resolution. How long are you going to take it after you get better? How long are you going to continue on the antidepressant? What's your relapse prevention plan once you get better? And so when you think about it in this big picture way, that's the part to me that worries me when the search term comes up, which antidepressant causes weight loss or weight gain? Because if we're talking about a serious medical condition, and you know, we're thinking about, usually even in even in some of these that cause clinically significant weight gain, if you're thinking about a 5 to 10 pound weight gain over the course of 6 to 9 months in exchange for curing your depression, and then thinking about a plan after that to come off the medication. Do you see where I'm going with this? It worries me just a little bit, and it's definitely what I found all of the fucking time. Like, treatment planning is sort of a lost art. It's like, you know, a lot of times I think in our medicine systems, it's like, let me give you this, and we'll check in a month. And if you, the patient, are not reaching back out to your doctor, it's probably just assumed like, okay, everything's fine. I guess they're better. You know, and people, the most common thing I see is that somebody's on antidepressants for years. And when you talk to them, they're like, I don't know if that was helpful. Like, I started it like a year ago. I'm depressed again now. Like, so there's not a lot of thought put into the treatment planning. So that's what I'm going to talk about a little bit next time. So thanks for watching this, and yes, like, share, and subscribe. Like, I'm not at that point to really say that, but I've always wanted to say that. Like, share, and subscribe. Okay, I forgot one other thing. I didn't tell you the medication that causes weight loss. It's called Wellbutrin, also known as bupropion. However, it's just a little bit of weight loss. And actually, it's kind of complicated, because in my own clinical experience, you just get it kind of once with that medication, and usually just for like the first 4 to 6 weeks. And it's, I don't know, the people who are losing weight on it it doesn't always seem like the most pleasant kind of appetite suppression that they're having. But that's one that we'll often use for when we're thinking about trying to achieve weight loss. Okay, that's it. Thanks for watching.